I am Dr. James Making. Thank you for giving me the chance to present today. I use a more topography system for better visual evaluation. Using a photograph equipment using contour lines can be effective in more objectively showing the before and after of the lifting procedure. FRA is a newly designed skin diagnostic equipment which effectively enables the imaging and imaging of wrinkles and the unevenness of the facial skin surface via capturing the contour lines of the face through Moore effect. This is before and after. If the distal sagging region gets lifted, you can see the contour line is contracted. The face also become more symmetrical after the procedure. Hollowed part of the cheek gets fixed. These are regular photos of the before and after of the patients. If you compare the photos of before and after the procedure, you can notice the face has generally been lifted. Here you can see the face has generally been lifted based on the horizontal line, the direction in which the face is lifted can be identified by looking at the contour lines. The contour lines were lifted. The distorted lines due to the sagging became round. One contour lines has been reduced after the procedure. The skin was plumped up by 1.5 millimeter, and the size of the mouth has become flatter as the tissues that were sagged towards the direction of gravity were lifted. The contour line changed. The direction of sagging changed from 90 degree to the direction of the gravity to the direction of muscle. We can judge the extent to which the face was lifted by looking at the change in the shape of contour lines on the cheeks. Here, you can also notice that the corner of the mouth, contour line on the cheeks gets shrinked after the lifting. The direction of the jaw due to sagging gets changed due to lifting. This is the before and after analysis of the patient. If the sagging of the cheek uh, is the direction of the sagging gets changed and no longer 90 degree or the direction of gravity, as the jaw became uplifted and the hollow part of the cheek also decreased significantly. The direction of the sagging gets changed and jaw became uplifted. The hollow part of the cheek also decreased significantly. This is all pre-procedure photo before. The front of the face in the pre-procedure photo looks symmetrical, but the side photo clearly shows that there is a different degree and direction of the sagging on the left and right, and also the shape of the jowl sagging is different on each side, indicating that the treatment plan should be different for each side. This is for assessment of wrinkle severity. FRA is highly useful in that it is applicable to all cosmetic surgeries by providing clear diagnosis and visible confirmation of the results, and thus effectively satisfy the needs of both clinics and the patients. I applied the relative values of FRA control lines interval to WSRS scoring. If the numerical value of the first control line is 1.0, the degree to which the value changes as the closer you get to the laser BF4. In the post-procedure comparison photos, you can notice the change in WSRS scores, the correction of sunken part, and the changes in the jowl. WSRS scores improved from 3 to 1 after the procedure for the patient on the left and 4 to 2 for the patient on the right. Thank you so much.